Hello, everyone. This is the Doctor is in. I'm Dr. Freddie Gomez. We want you to make the most out of your telemedicine appointment today. So send in your questions and we'll do our best to answer them. Today, we'll be busting myths about COVID-19 with the help of our guests. So misinformation can spread just as fast as a virus and can cause just as much harm if not addressed. Over the next 30 minutes, we wish to provide just the facts so we can all stay safe and healthy. Let's start by debunking myths about COVID-19 and the food we eat. Maraming kumakalat na balita tungkol sa mga pagkain na nakakapagpagaling daw ng COVID-19 o kaya naman nakakatulong in preventing the spread of the virus. To talk about this topic, we have Aleli Elizabeth Magtibay, who is a certified nutritionist and dietitian. Welcome to the show, Aleli.
Hi, Doc. Good afternoon.
Now, getting nutrients from the food we eat is one way to boost our immune system. But there are also claims circulating online that certain foods help fight COVID-19. Isa na dito ang chilies, masile, or peppers. Is it true that eating chilies or peppers can prevent or even cure COVID-19?
I wish that were true, no? So that the problem will be solved now. No, there is no specific food that can treat, cure, or prevent COVID-19. If it's just one single food, we're talking about a family of nutrients. So this time, probably, we have to make sure that people understand what is immunity. Immunity is when you build your resistance against infection, or at least you give your chance a greater probability of recovering from it. So, hindi ka magkakaroon, or kung magkaroon ka, mabilis ang pag-recover mo. Pero walang isang pagkain, kagaya ng pepper or garlic, ano pa ba, napabalita, banana, na pwedeng sugpuin, no? Ang COVID-19. It has to be a whole range of healthy diet. Sama-sama sila. Because the nutrients have to work as a family para ma-build yung immunity against infection. So, hindi isa lang.
Now, you mentioned garlic also, no? Aside from peppers, garlic din ang pinag-uusapan o bawang. Now, why would people associate garlic with a cure? What benefits does garlic provide?
Well, maganda ang garlic kasi ang garlic has functional ingredients, no? Sabi pa nga, it can lower blood pressure. At the same time, may antibacterial effect siya. However, yung dosage mo, hindi mo na alam. At saka isa pa, hindi naman siya proven against virus. And pangalawa, usually yung mga test na ganito, okay siya in vitro sa petri dish. Pero pag sinabi mo sa katawan, ano ang reaction ng isang katawan para dun sa garlic mag-isa? At saka kung totoo yun, Doc, kakain ka ba ng garlic maghapon? Puro garlic lang to prevent the infection. So it has to be variety, no? Isang pamilya siya ng nutrients. Walang pagkain na pwedeng isa lang ang pwedeng mag-treat, mag-cure, o mag-prevent ng isang infection.
Now, this is a popular topic online. Let's talk about eating bananas. Well, it is a good source of potassium. Kaya ba talaga nitong labanan ang COVID-19?
Hindi rin, Doc, kasi sabi mo nga, potassium lang. Para labanan mo ang isang sakit, kailangan maraming nutrients. So siguro, Doc, dapat naintindihan ng marami na you have to eat plenty of healthy food, and that's a balance of it. So pag sinabi nating balance, dapat sapat ang what? Energy na kinakain mo, na nanggagaling saan? Carbohydrates, protein, fats. Yung pa lang, dapat kumpleto na sa isang plato. Dapat meron ka doon carbohydrate na pagkain, 1/3 ng plate mo. Tapos 1/6 ng plate mo, may protein. Tapos dapat meron ka ring gulay at mga prutas. So, hindi sapat ang isa lamang. Isa, para lang magkaroon ka ng immunity. Hindi kaya ng banana ang COVID-19.
Now, let's answer some questions from social media. We have a question from Reynolf. Ang tanong niya is, are there any foods that can help me fight COVID-19?
Ayan, yan ulit ang tanong. Babalik ulit ako sa paulit-ulit kong sinasabi. Dapat naintindihan ng marami na talagang healthy, balanced diet. Ano yon? Ang ibig sabihin nun, dapat may carbo, protein, fats, vitamins, minerals, water. So, ibig sabihin nun, dapat kumakain ka ng variety ng mga pagkaing mayaman doon. So, kung sa isang plato, sabi ko nga, kung ang 1/3 nun kay isipin mo carbo, yung 1/6 nun para sa protein, no? Yung 1/3 nun para sa gulay, yung 1/6 ulit para sa prutas. Iba't ibang klaseng prutas. Dok, kasi hindi talaga pwedeng isa lang. Kung puro banana, di puro potassium. Kailangan ko ng vitamin C. So, kailangan meron din akong orange. Pero kaya ba ng orange lang? Hindi rin pwede kasi vitamin C lang yon. So, para magkaroon ng kumpletong resistance against infection, hindi dapat mag-overdose ng isang vitamin lang kasi vitamin C cannot do it all. So, kailangan may vitamin D, kailangan may vitamin E, kailangan may K, kailangan may antioxidants. Andun sila lahat. So, fatty acids, kailangan kumpleto din. So, paano yun? Magbibilang ka ng magbibilang, hindi mo alam kung nasaan. So, kaya sa nasabi namin, huwag kayong magbilang ng calories, huwag magbilang, kundi variety ng pagkain. Sa isang plato, dapat meron kang variety. Nandun ang prutas, ang gulay, ang carbo, ang protein na nanggagaling sa karne, isda, o ano man ang protein source mo. Kung vegetarian ka, di tokwa, tofu. So, yun ang ibig sabihin ng balanced diet, no? Kailangan well represented yung lahat ng pagkain natin, no? So, cereal, dairy, protein-rich food, tapos meron kang carbo source. Yun, Dok.
So just to summarize, so walang isang pagkain ang pwedeng makalunas with COVID-19 in general. Ang pinaka-importante, balanced diet pa rin, nutrition, like what you mentioned, a lot of variety with our foods, fruits, vegetables, carbohydrates, proteins as well.
Yes, Doc.
Thank you very much, Ms. Aleli Magtibay, our nutritionist and dietitian, for sharing your information with us with regards to what to eat or what mga myths sa mga pagkain ito. No? So we have to pause for a quick break, but when we return, we'll address more COVID-19 myths with our infectious disease specialist. Stay tuned. Hi, and welcome back to the Doctor's In. I'm Dr. Freddie Gomez. So we hope that while you're staying safe at home, we can provide you with the medical advice that you need. So there are unconfirmed reports circulating about hygiene and COVID-19's effect on animals as well. So we want to get the answer straight from a medical expert to see if this is true or not. So right now, we are joined by Dr. Carmenchu Echiveri Villavicenio, who is an infectious disease specialist from the Makati Medical Center. Welcome to the show, Dr. Menchu.
Good afternoon, Freddie.
So let's continue to debunk more myths about COVID-19. We're continuing about the myths or debunking myths about COVID-19. Let's talk about personal hygiene. Some believe that taking hot baths can possibly kill the virus. What is your take on this, Doctora?
For the hot baths, well, one is hot baths doesn't protect you, but it can prevent you in a way that you can clean your skin. But we don't necessarily need to take hot baths. We just need to take a bath, even with just regular water. The temperature of the water doesn't actually necessarily give you extra protection from COVID-19. So the best way, again, to protect yourself is to make sure that in your hands, and by taking a bath, you actually clean your hands and protect yourself from touching your eyes, your mouth, your nose with dirty hands.
Now, Doctora, saline sprays is mostly used naman to treat colds, and so people have associated it with treating COVID-19 when showing symptoms. Does rinsing your nose with saline spray offer a way to prevent or cure COVID-19?
Salino's solution does not actually prevent you from having COVID-19. There is no evidence that regular rinsing the nose with saline has protected people from infection with the new coronavirus.
So, moving on to a different kind of species naman, ano, there have been debate about whether animals, especially dogs and cats, can contract and spread the coronavirus. Is there any truth to this? Can we actually pass on the virus to our pets?
There's actually one case report from the States wherein there's a tiger that had COVID-19, and they believe that the tiger picked it up from the zookeeper or zoo employee who tested positive for COVID-19. Although we don't know exactly the source of the current outbreak of coronavirus, but we know that it originally came from an animal source. But there's no evidence at this time if animals really play a significant role in spreading the virus that causes the COVID-19. And also with that case, they're actually also still doing their investigation. And again, for everybody, we just need to make sure that we practice proper hand hygiene and the distancing. I guess if you're worried about your animals and you have the infection, probably it's not best to handle the animals right now and distance yourself from them.
Yeah, so that's a good thing to know that animals aren't the main drivers of the spread of the infection. And it all goes back to proper hygiene, proper hand washings, and social distancing as well. Now let's take some questions from our online viewers. We have one from Abriel. Ang tanong niya is, ang langaw ba o lamok nakaka-spread ng coronavirus?
Again, there's no evidence that mosquitoes can spread the coronavirus. So right now, what we're worried about, because we've had a typhoon recently, I think we're worried about more for vector-borne illnesses or waterborne illnesses or infection that rises during the rainy season, like dengue, leptospirosis, but not necessarily COVID. For the mga lamok.
We have another question from Anela. Are there visible signs and symptoms for COVID-19 in animals?
For this particular case, the one that they noted in the US, this is actually the first documented case in animals. The tiger and the other animals as well had respiratory symptoms. In particular, they had colds. So they are actually still doing a study with this animal.
So we have to pause for a quick break, but when we return, we'll discuss research and development about this COVID-19 disease. We'll be right back. Welcome back to the Doctor's In. Now let's continue to bust some myths about COVID-19 with our infectious disease specialist from the Makati Medical Center, Dr. Carmenchu Villavicenio. Now we'd like to tackle the tools and technology that some claim can help in the fight against COVID-19. I've noticed that a lot of companies market UV light as a way to detect and kill bacteria or possibly even the virus. Doctora, can these tools also be used to disinfect our bodies?
So word of caution for the UV light, UV radiation can actually cause skin irritation and damage to your eyes. So it is actually and should not be used to disinfect your hands or other areas of your skin.
Okay, that's good to know and get that clear. Now, since there are some studies that bacteria thrive in cold and wet environments, and since the coronavirus is transmitted through droplets, some people may assume that keeping things dry and warm can prevent getting COVID-19. What is your take on this?
Okay, so again, with the virus can actually be transmitted as of now, like through any climate, including areas with hot and humid weather. So I don't think that we should be complacent because we're in an area or a country that we have warm weather. As you know, we still got the COVID-19 cases. So this does not prevent us from having a COVID-19.
Now, another complication of COVID includes developing pneumonia, and some have treated the disease in a similar way. Can vaccines against pneumonia protect us from COVID-19?
The vaccine for pneumonia specifically targets the bacteria Strep pneumoniae. So that is actually not the same as the COVID-19 virus. Although it is advisable to get the vaccine to protect you from getting that strep pneumonia. It's actually not used for preventing COVID-19 infection.
Now, speaking of vaccines, there have been a few studies conducted over the past few months, and some promising results have actually been published. Uh, do you think, Doctora, that with all these that is going on, that we could actually see a vaccine in the near future?
Everybody is actually praying and hoping that we there will be a vaccine soon, so that we can actually get things back to normal. But right now, there is no definite vaccine yet. Hopefully, it will be out maybe in 6 months to a year. But definitely, there are studies on the way.
Okay, now it's time to check out some of the social media questions. We have one from Miguel. He's asking, is a strong immune system enough to fight COVID-19?
So we have some patients who do not have any comorbidities, meaning that they are healthy patients, and yet they still got infected with COVID-19. I guess having a strong immune system can actually prevent you from getting a severe infection, but uh, there are still studies that will prove that this is enough. So again, the best prevention would still be to make sure that we have clean hands with hand hygiene. But keeping ourselves healthy will at least give us a fighting chance in having a severe infection.
Now the question from Roxy. How effective are air purifying and sanitizing sprays?
Okay. For air purifiers, there's actually just a medical grade purifier that can handle these types of infection. But when you think about it, if you have proper ventilation, if you have good air exchange, I mean that the air is circulating and exchanging in the proper manner, then you do not need air purifiers. If you have windows, then you just keep it open. Now, for the sanitizing sprays, it depends on where you use it. Of course, it is not advisable to use it on your skin. We can use that to actually sanitize our objects or items that are highly touched areas, or objects that are items that are highly touched. But the sanitizing sprays needs to be, um, again, used with the chemicals that can kill COVID-19, for example, like bleach.
Okay, and our last question from Kathleen. Are there any foods or medicines to avoid consuming for now which may feed the virus?
There are no proven food or food that you can consume for now that may lead to COVID-19. I think in terms of medications, there might be some, but none that specifically was noted through a study. So there are a lot of
Okay,
investigations
now
still on medications.
that's right. I agree with that. Do you have a short message for our guests before we go, Doctora, such as where can we find clear and reliable information and maybe how to stay safe from COVID-19?
Okay, so well, we'd like to thank, of course, CNN and to all. This has been a venue to actually educate the public on facts about COVID-19 and how to protect yourselves. Also, our Department of Health is doing their best to actually educate, and our government to educate people on what to do to make them to prevent themselves from having COVID-19. I think now is the best time to actually just follow our government and our Department of Health and support them in a way. We can do our part to support our government and the Department of Health in curbing this infection by actually practicing the guidelines that they have implemented for our country.
Okay, thank you very much, Dr. Carmenchu Echiveri Villavicenio, for joining us and sharing once again your knowledge with regards to COVID-19. Always a pleasure to have you.
Thank you, Freddie. Stay safe.
And thank you to our guests and viewers for joining us on The Doctor's In. Hopefully, we were able to clear the air about numerous theories going around in regards to COVID-19 and that you can now be guided by the facts. Continue to stay informed and updated by tuning in again tomorrow, 3:30 p.m. on The Doctor's In, only here on CNN Philippines. I'm Dr. Freddie Gomez. Stay safe, everyone.